This is the Emergency Medical Minute, sponsored by Health One.
So we're going to start with a medical minute about facial analgesia. So this cool thing is that you guys do a lot of numbing for us, which we greatly appreciate. But let's say there's a guy who comes in and they have a cut right across the forehead. How are you going to numb it? You don't know it? Yeah. So a lot of times with this, you'd go in and you'd basically just go all around the cut, right? And here's where, if you do that, we'll oftentimes distort the anatomy, especially if it's on a lip, if it's on a nose, or if it's on the face. And these are areas where we actually want to take our time and do a really great repair. So with something like that, we don't actually want you to go right into the wound and numb it. So if you know just normal facial anatomy, you can get anesthesia to any part of the face by going away from where the actual injury is. So we'll go through the nerves, right? First, you have the trigeminal nerve. That gives you all the sensation of the face, where the facial nerve gives you all movement. So movement nerves and sensation nerves are disconnected in the face, right? You have your V1 area, which goes tip of the nose up to the forehead. That's the V1 area. V2 is kind of cheeks, and then V3 is kind of chin, right? If you all remember that from nursing or medical school. And there's two nerves that you should know about that come out from very reliable places. So if you have a guy with a cut right across the forehead, you can actually go right here to where the eyebrow is, the close part of the eyebrow, and just numb here, and they'll get complete analgesia to the entire forehead, right? So you can numb right where the eyebrow is to get the whole forehead numb. If they've only got a cut on one side, just do the one side. That's called a supraoptic nerve block. Now let's say someone has a nose ring that got ripped out, right? Numbing cartilage is no fun, but you have this actually dorsal nerve of the nose that comes reliably down here down. So if you have an injury down here, you can just numb right across the bridge of the nose, and that person's going to get good analgesia. And you guys are already used to this. You do dig blocks all the time, right? This is just kind of like dig blocks of the face, and that's the dorsal nasal nerve. If someone's knocked out their teeth, or if they have a big lip lac, the nerve actually comes out from right here. It's called the infraorbital nerve. And you can actually just push on yourself, and you can see, hey, that's pretty damn sensitive. And that infraorbital nerve you can numb very easily, gives you numbness all the way to the lip and to the teeth there, okay? Going down further, if someone has a lip lac, the mental nerve comes from right down here, kind of right to the dorsum. So you can actually just go right down here with a needle, put a good amount of numbing medicine, and patients get great analgesia. The last ones that aren't as useful are the zygomatic nerves. So there's a zygomatic temporal and a zygomatic facial nerve that come right here from lateral to the eye. So if a person gets cut kind of right here on the lateral of the forehead, you can actually go in here right by the eye and put a good amount of analgesia, and the patient will get numb all the way to the kind of temporal area of the forehead. Okay, and what that allows you to do is you're not poking the patient where they're having their most pain. You can oftentimes use a lot less anesthetic because you're numbing right where the nerve is. And you can allow your docs to do a much better repair because, hey, now there's not a bunch of anesthetic distorting our anatomy. Okay? And there's some great diagrams out there for Emergency Medical Minute. We'll try to pop one of those up so that all of you know kind of where to numb when you're numbing faces for us. Yeah. So if they have a whole eyebrow cut, what you can try to do first is just kind of go, that nerve comes out right here in the supraoptic notch. You can all push yourself there. It's a pressure point, right? And if you push yourself there, you can try to just do a proximal block, kind of where you go right here and then just put a few cc's of anesthesia there and see if you get numbness to that entire area. If you do that and give them a few minutes and then poke them with the needle and say, do you still feel this? And they say no, then hey, you're done. You can just start rinsing it out. If they say, oh yeah, I still feel it, they might have some innervation from one of the zygomatic branches because everyone's just a little bit different, in which case then you'd go ahead and do the traditional nerve block. The last one I'll tell you about is what's called the greater auricular nerve block. This is a pretty sexy one, where if someone has an ear injury, nerve blocks to the ears or field blocks are really painful. Traditionally in med school, you're taught like, hey, just make a diamond around the ear and just put a shitload of anesthetic. And it's like, owie, super. And there's a greater auricular nerve that comes out here from your mid-neck and goes all the way. And in some people, it does the whole ear, but in most people, it does the bottom half of the ear. So if someone has an infected earring or they have a cut to the bottom of the ear that you're going to need to repair, all you need to do is go right over the sternocleidomastoid, go right across it, and just do a crap load of anesthesia, and that nerve's very superficial. You don't need to go deep, and you usually get really good analgesia and don't have to futz around right by the ear, which is sensitive. Yeah, cool. So numb smarter, not more.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.